So your doctor just gave you news that your kidney health is getting worse and it's time to prepare for dialysis. But what the heck is dialysis and why do you need it? Kidney Warrior Brick here, and today I'm talking about dialysis. Now, there's a lot to be said about dialysis, including all the complications that come with it. So if you enable to 24 But today, I just want to inform y'all what it is, why it's important, the different types, and I'll give a little demo on PD at the end. Simply put, dialysis is what is called renal replacement therapy. Quick recap, renal is the medical term for kidney. Knowing this, dialysis isn't something to be stressed out over until stage 5. That's typically when dialysis is recommended to patients. And it is a recommendation because you, as the patient, have the power to decide if you're willing to do it at this time. However, in my opinion, the choice not to do dialysis is less favorable. And hopefully, after watching this video, you'll be less stressed about choosing to do dialysis. So in stage 5, when the GFR is less than 15, is when doctors start to assess if and when the correct time to start dialysis is. While there are many factors that tell the doctor the correct time, most patients start to receive dialysis when GFR is between 12 and 7 or even low as 5, though some patients decide to wait even longer than that. This brings me to an important point to reiterate that yes, as a patient, not only do you get to decide if dialysis is right for you, but when you want to start. You could even wait till your GFR is 1 or lower. But let's talk about why that's not a good option. First of all, let me just state that doctors do have your best interests in mind and not just trying to push some medical treatment on you so they can get paid. Prolonging dialysis does increase your chance of several different health issues, such as worsening edema, which we've talked about in a previous video. Most patients experience this in stage 4, but also things like pulmonary edema, pericarditis, hyperkalemia, hyperphosphatemia, calciphylaxis. Calciphylaxis, by the way, brief point, if you gain this type of disorder or disease, you then lower your chances of actually getting a transplant. So calciphylaxis is a big issue if you're hoping to get a transplant. In any case, other things that could happen are excessive lethargy, coma, and even premature death. Nobody wants that. And some of these you may not even notice before damage actually occurs. But enough of the bad news. Let's move on to the types of dialysis. There are 3 types of dialysis. However, one type, continuous renal replacement therapy, is mainly used in those suffering AKI or acute kidney injuries. And for now, my YouTube page is focused more on just general kidney health, kidney information, and chronic kidney disease. Maybe in the future, that's something I can expand into, acute kidney injuries or AKIs. But for now, let's focus on chronic kidney issues. So with that said, let's focus on the other 2 forms for those with CKD, chronic kidney disease, which are hemodialysis and peritoneal dialysis. Hemodialysis, in my opinion, is the best method for dialysis for those who are wanting to get the best kind of cleaning treatment of dialysis, but I'll cover this in another video. For now, let's focus on what hemodialysis is. This type of dialysis will actually need to access your blood through one of 3 different ways. A CVC, which stands for central venous catheter. You may also hear it called a central line. Generally, this is put around the neck area. It is the most risky form of hemodialysis. Therefore, doctors will limit things like showers and swimming. And it's a big bummer when you can't go out in the summer and swim. That's my favorite thing to do. But I know a lot of people also like showers. So showers and swimming with a central line. If you're wanting to do hemodialysis, you better choose a different access. So the other 2 accesses are actually a graft or a fistula. And these go in the forearm, the leg, or even a little bit higher up on the bicep typically. The fistula is more of a natural access in that it is formed by combining your vein and artery, while the graft is created by inserting a tube into your arm or leg. Again, it depends on where they want to place the graft. 3 common areas: the forearm, the bicep, and the leg. However, these forms of dialysis give more freedom than the one that had the CVC, and that you're no longer restricted in your activities such as showers and swimming. Perfectly fine to get into the water. However, I would like to add that depending on how strong your veins are in the places that they choose to do the fistula or graft, you may be limited on how much you can do physically, like how much you can lift or whatever. Now, with regard to treatment, or if you prefer to call them therapy sessions, since the body's not actually treated as in curing something, but you are cleaning the body. In any case, in regarding to sessions, for hemodialysis, there are 2 different ways to do this. The first is in center, and if you choose to do a center, this is a place that you will go and you'll spend 3 days out of the week here, anywhere between 4 to 6 hours. How often you go and how long you go is determined by the labs that they do for hemodialysis. However, for those not wanting to go to a center and prefer to keep things a little bit more personal and maybe do treatment inside their house, in the past decade or so, you could actually do hemodialysis at home. Though there is a lot of equipment and storage space that would be required for this. Personally, I never tried at home hemo. However, I did in-center hemo for 8 years, and that could be a little bit tedious at times, kind of like a job, you know, you're always busy, you have to go somewhere, and you spend basically anywhere between, like I said, minimum time on hemodialysis is about 3.5, 4 hours. So 4 hours plus the time that you got to take to get ready to go to the center, plus the time you got to wait for your time on the chair, plus the time you got to wait to go home because they like to make sure that you're not bleeding before you go home. A lot of people end up losing blood from the wound opening once they leave dialysis, so they try to keep that to a minimum. At the end of the day, you can spend about 8 hours, 9 hours just doing a treatment, or all the things combined for a treatment, not to mention basically the required rest that you need after this treatment because it's taxing to your body. Like, it's very draining. A lot of people do kind of find that they can maybe do a little job, especially office work after that. I was a stock boy when I first did hemodialysis, and I didn't do it right when I started dialysis. It was probably like 3, 4, 5 years after I was doing dialysis before I actually could hold a job. And even then, I probably worked only a couple hours the day I did dialysis. Most often didn't work, but I would go to work the next day. Wow, there really is a lot to say about dialysis. Unfortunately, I'm going to have to wrap this video up. So if you want to hear more about dialysis, especially peritoneal dialysis, make sure you check out part 2. Hit that subscribe button so you don't miss it. And while you're at it, go ahead and hit the like button for the YouTube algorithm and leave me a comment. Let me know what you're thinking about my videos so far. Till next time, warriors.